Today, we learned 66% of the eligible people here in Travis County are vaccinated. So that means over 300,000 people are not protected. The update came from Austin Public Health's weekly COVID-19 briefing.
What we're seeing with this Delta variant, that unfortunately, those that are younger, that feel invincible, are not against this disease.
When it comes to booster shots, Austin Public Health says they are confident they'll have a plan to present to city leaders next month. Yesterday, Austin City Council members voted in favor to come up with a comprehensive booster shot plan ahead of the surge of people who will need one later on in the fall. Council member Vanessa Fuentes brought up the resolution, and KXAN's Grace Reeder spoke with her before this meeting on the plan for that third shot and how to convince others to just get their first one.
If I could have you first start by talking about what it is that you all are bringing forward today and the intended impacts of that.
Sure. So I'm bringing forward a policy resolution that calls for a booster shot strategy plan. And this is important because, as we know, President Biden has announced that effective September 20th, they will start rolling out additional booster shots. And it's important that our local entities, Austin Public Health, are prepared to meet the moment. So we're talking about 4 weeks from now, we will have booster shots available all across the country. And so we need to ensure that we have a plan that builds upon lessons learned from the initial vaccine rollout that we had here in Austin, a plan that is rooted in equity, that addresses barriers to accessing the vaccine, and also a plan that ensures that we are being proactive and that we're doing all that we can to ensure that we can get to the other side of this pandemic.
Can you talk about specifically for your district, and it's something that we've been reporting on, is that there's been large disparities in Latino communities when it comes to even just getting that first dose of the vaccine. Can you talk about sort of why for your district in particular this is such an important resolution for you?
So the community that I represent has some of the lowest vaccination rates in the city. That's our Dove Springs community and our Del Valley community. And we also have some of the highest hospitalization rates in the city. And so what we're finding is that there is significant vaccine hesitancy. There's mistrust in public institutions, and there is a lack of information. Folks are saying, well, the vaccine became available too quickly. I can't trust it. And so just a few weeks ago, I brought forward policy that called for the investment in community health workers, which I was really proud to see my colleagues join in supporting me in that effort. So now we're going to have even more individuals on the front lines helping us address the concerns that have been raised and building those connections with our community to have the conversations. We know that for folks who still have not been vaccinated, we really had to have that in-person connection and have a conversation as to how your experience went with the vaccine and to talk about why it's needed for the health of themselves, but also for the health of our community.
What from that December, January vaccine rollout do you think can really be done differently with the booster rollout and can really sort of shift this go around?
What we saw with the initial vaccine rollout is that it was primarily online. And for communities like mine who struggle with the digital divide, if you're on the other side of that divide, it's going to be extremely challenging to be able to sign up or to understand, where can I go to get the shot? Also, it took a long time for us to have a robust public education campaign. The Latino PSA created by the city wasn't released until just a few weeks ago. And we are in the 8th month of the vaccine rollout. And so we really had to ensure that we're prioritizing our most vulnerable, our communities that have been disproportionately affected. Latinos here in Austin make up more than half of the deaths from COVID. And so we have to do right by our community. And so that's why it's really important that we have this plan, that the community is part of the creation of the plan for the booster shot strategy, and that it's anchored in equity as well.